this is the chest trigger. My name's Jonathan. From the printer over here, I've just picked up a rec for a 2-view chest x-ray. So, I see the patient's name and date of birth, and I also have a barcode on here, so I'm just going to scan it into the machine and it will pull up my patient's name and information, and the 2 exams, the chest PA and the chest lateral, so I can see that those are the exams that I need, that those are the exams on my rec. Everything matches so far, so we're looking good. I'm going to grab 2 films, one for each picture that I need to take, and I'm going to head into the room and set up the room. So, I'm going to just leave one of the films right here for right now, and I'll be back for it later. In the meantime, I'm going to set up for my first picture. I'll put the film in crosswise for the chest PA and put it into the wall bucky. Now the next thing I need to do is to set up my tube. So the 2 things I need to make sure that I have in place so that the tube is on center lock. So I'm going to make that happen. And I need to make sure that the tube is 72 inches away from the bucky. So here we go. So I've just detented the tube 72 inches away from the bucky. So my tube is set up, my bucky is set up. I'll make sure that everything is all lined up here in a moment when I know how tall my patient is. So I'm going to go get my patient right now. Tanisha? Hi. My name's Jonathan. I'll be taking your x-ray today. Pardon me. I can also take this for you.
Alright.
Perfect. These are from your doctor?
Yeah.
So I'm going to check here to make sure that the doctor order matches the rec that I have. I want to make sure I'm taking the right exam. And then look at everything. This also says lateral chest and PA chest, so everything matches. Tanisha, can you tell me your last name?
Suarez.
Alright, and your date of birth?
6592.
Alright, excellent. Is there any chance that you may be pregnant?
No.
Okay, alright. What brings you in today?
I just feel like I haven't been able to breathe right for a little bit.
Okay, how long?
I would say like a week.
About a week? Okay. Any history of lung problems or
No.
cancer? Okay, alright. No surgeries in that area? Okay. Alright, I'm going to set these down here. And Tanisha, I'm going to give you this gown to put on.
Okay.
What I'm going to need you to do is to remove everything from the waist up, including
Okay.
undergarments. Put the gown on so that it's covering your front.
Okay.
Alright, I'll step out for a minute and let you do that.
Alright.
So I'll go ahead and step outside.
I'm ready.
Alright. So, I've given Tanisha a moment to get ready, and she's ready to go. So here we are. What I'm going to have you do, Tanisha, is stand up here with your chest next to the board.
Okay.
And actually, before we have you do that, can I have you put this on?
Sure.
It's going to cover your backside and just fits on like a belt. Alright. There we go. So chest on the board, perfect.
Okay.
And you can go ahead and put your hands on these little handles here. Alright. Now I'm going to make sure that everything is lined up according to Tanisha's height. I collimate to the size of my film, which is 14 by 17. And Tanisha, can I have you pull your hair to the side?
Yeah.
Perfect. Alright, thank you. Alright. So I want to have about 1.5 to 2 inches of light above her shoulders while they are relaxed. My central ray is going to enter at T7. And it helps me to think of getting the vertebral prominence in the picture. That way I'm kind of assured of getting the lung apices in there as well. So this is looking good where my light field is. I'm going to need to move my bucky a little bit to make sure that my bucky is lined up with my tube. So that everything's going to shift down just about 1 inch here. Actually, it's going to shift up. Here we go. Alright, there we go. Hands back on the handles there. Excellent. You're doing great. Can I have you shift a little bit towards my hand here? Perfect. Alright, and roll your shoulders just a little forward. Excellent. So we're positioned, we're ready to take our first picture, so I'm going to come back here. Alright, Tanisha, can you, I forgot to put my marker on there. Left marker on the left side. There we go. We are now ready to take the picture. Tanisha, can you take in a deep breath and hold it? And I'm watching her to make sure she breathes. Ding! Breathe now. So I always want to watch her after I give the instructions to make sure that I'm taking the picture at the right time. So I wait until I see that her lungs are filled with air and she has stopped breathing. You can go ahead and relax, Tanisha. We're going to do one more picture. And I have my other film here. So I'm going to trade out my films. This time I'm going to put it in lengthwise for the lateral. I'm going to take this one out of the room and just leave it right there. I'll read them both at the same time. Tanisha, can I have you turn and face me? And go ahead and put both hands up here. Perfect. All right. I'm going to move the wall bucky down about an inch or so. And now I need to also adjust my tube to make sure that tube and bucky are aligned once again. And here I see that they are. All right, Tanisha, can I have you move forward just a little bit? Excellent. I want my crosshairs to be right under her armpit. Again, we're shooting for central ray entering at the level of T7. I want to have a little bit of light on each side of her, and she's small enough that I can do that. So just a little bit more forward. Excellent. All right. And we've got our crosshairs right there under the armpit at the level of T7. I'm going to put my marker on again. And once again, we are set up. Normally this happens automatically. The light field changes according to where the cassette is. So I just needed to make that adjustment there manually. But we are good to go, so I will come back here and take my second exposure. Alright, and before I take the second exposure, Tanisha, can I just have you shift your belt around so that you're covering the side? Perfect. Okay, there we go. Alright, crosshairs are still in a good place. We're ready to take the second exposure. Tanisha, once again, can you take in a deep breath and hold it? And she does. Beep. Alright, breathe, Tanisha. You can go ahead and relax your hands. Alright, I'm going to go take a look at the pictures. You may take a seat if you would like. I'll be back in just a moment. So I take both of my pictures, and I head back to the reader with both of them. I scan one of them in and stick it into this reader. I scan the other one in and I stick it into this reader. And I wait a few minutes. And here's my chest PA. I see that I have my lung fields in there. Things are centered. They look pretty good. Second picture, this is the lateral again. I have the lung fields in there. My S number is all right. I have all the anatomy that I need, so I can go ahead and let Tanisha go. So I'm going to come back in here. All right, Tanisha, we have all the pictures that we need. You can go ahead and remove the shield.
Okay.
And I'll step out and let you dress again. Do you know how to get out of here?
Yep.
Okay. All right. Do you have any questions for me before you go?
No.
All right. Thank you, Tanisha. I hope you start feeling better soon.
Thank you.
All right. And I will step out and give her a moment to change again. And that's that.
Right. So I just sent Tanisha on her way. And before I let her go, I took a quick look at her chest radiographs to make sure that I have everything I need and that I don't need to repeat anything. So I'm going to take a moment here to talk about what it is that I look for to make sure that I have everything that I need. This is her chest PA, which I shot at about 110 at 3. She's relatively small, so I didn't need to use a very high technique. So 110 kVp at 3 mass. And I want to make sure with the chest PA, when I'm looking at the image, that I don't have any rotation in it, that it's straight on. And the way that I judge that is I look at where the air-filled trachea is right here, and I measure along the clavicles, and I want to make sure that each clavicle is about the same length. So I have equal distance from the sternoclavicular joint here to the AC joint right out here. So that looks pretty good. Also, a big deal is to have the entire field of the lungs from the apices to the costophrenic angles. So I've got the entire lung fields there. I want to see 10 posterior ribs. So let's see, I've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we're looking good there. I want to see the shadow of the heart here, the shadow of the aorta. I want to see the thoracic spine showing through the shadow of the heart and the aorta. I have good contrast here so I can see some of the markings of the lungs. And I have my marker up in there, and I do see the trachea. I see all the anatomy that I need. I have the parameters that I need. Collimation looks good. We're centered. We have a good technique. We have a quality diagnostic image. This is her lateral chest X-ray, which I shot at about same kVp, 110 kVp, and about 6 mass. So I took the mass and doubled it. Since we're looking at her side, we need more photons to be getting through the film to have a good image here. So again, the two big things with the lateral chest x-ray are that we don't want to have any rotation, and we want to see the entire lung fields. Now here we can see the lung fields from the lung apices to the costophrenic angles. So we're good there. We have a little bit of rotation here along the posterior spine, the posterior ribs rather. And so we can see kind of one here, one there, one here, one there. We would rather have them be completely superimposed. So she's not completely lateral, but I am not going to repeat the image because she's young and she is having a cough and so forth. I think this is a good enough diagnostic image. It doesn't need to be repeated. We have all the anatomy that we need. We can see lung markings in there. We see the hilar region here. We see the heart. We also see the thoracic vertebrae. So by and large, a passable image. So we'll get those sent over to her doctor, and he or she can take a look at them, see what he thinks, and then talk to Tanisha about what to do next.